This is one of the products I like to use on the donor area and recipient area post-surgery. It is nitric oxide. It consists of sodium nitrate and ascorbic acid, which is better known as vitamin C. So when you combine the two together, you will activate the sodium nitrate. And when you put it on, you initially get this little clear liquid. And then you add in a little bit of the vitamin C. There it is. And this can turn a little bit brownish as it oxidizes. But when we mix the two together, what will happen is it will form nitric oxide bubbles and stimulate blood flow to the scalp. And you start to see these bubbles are forming now on my hand. And that's the action of the ascorbic acid interacting with the sodium nitrate and releasing nitric oxide, which is N1O1. Okay, now that's also going to turn my skin a little pink. You see those bubbles starting to form. I'll just spread them out a little bit better. But my hand is going to start increasing in pinkness because the circulation is going to increase. So you just mix these together. Now I like to do this about twice a day. And then between these applications, or after this dries, we add exosomes, topical exosomes. And they will also help speed up the healing process. You start to see my hands starting to turn a little bit pink. So I really like this product. Been using it for a little over a year, but not every one of my patients, purchases it. It's not that expensive, but it's not that cheap. I think it's about 150 bucks. But it's a nice product.